Good evening, good morning, good afternoon, wherever you are in the world. You're watching the EBC international coverage of the coronavirus COVID-19 pandemic. I'm Anna Kui, coming to you from Las Vegas, Nevada. Tonight, we will hear from several of our correspondents across North America. We'll start with Thomas Likeness in Edmonton, Alberta, Canada.
Alberta scientists to test possible COVID-19 drug.
May Bondoc Ramos in Washington, D.C.
President Donald Trump says he has the authority to reopen the economy, but the governors of Maryland and Virginia might have a different view.
Next, we have Mayanne Manzano-Guerzon in Sicklerville, New Jersey.
Internet and phone providers in New Jersey are prohibited from cutting up services until 30 days after the COVID-19 crisis.
Philip Toledo in Atlanta, Georgia.
The governor announces the Georgia World Congress Center would stage an additional 200 beds for mild to moderate COVID-19 patients.
Next, we have Nicole Padilla from Baton Rouge, Louisiana.
Tornadoes hit Louisiana amid the virus crisis.
Michael Hudson in Seattle, Washington.
Washington, California, and Oregon unify collective coronavirus responses, announcing a Tristate pact.
Glessy Magaling in Los Angeles, California.
Eric Garcetti announces the LA Emergency Child Care Connection and the Critical Care Delivery Service Program.
And Rachel Ann Martin in San Francisco, California.
Hospital capacity in San Francisco shows a promising sign, with available hospital beds staying around 45%.
Plus, a conversation with a pediatric occupational therapist in Orlando, Florida, who will share with us how it is to see patients via telehealth services. And get to know a couple in Phoenix, Arizona, who says the pandemic definitely changed the way they spend quality time. But first, an overview of how the world looks now. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 3 Eastern Time, April 13, 2020, the number of cases of COVID-19 reported worldwide is so close to 1,900,000. This includes more than 568,000 in the U.S. and more than 25,000 in Canada. Sadly, this virus has claimed more than 117,000 lives. This number includes more than 22,000 deaths in the U.S. and more than 700 in Canada. Our coverage begins tonight. Alberta scientists to test a possible COVID-19 drug. Thomas Likeness in Edmonton, Canada reports.
Good evening, Anna. How are things in Vegas?
It's okay, Thomas. It's doing okay.
Just okay. But you don't have any snow and I do. All right, before I get into my report, I want to send birthday greetings out to that big talent from Hawaii, our EBC correspondent there, Alfred Asenis. Happy birthday, big guy. And I see you didn't let the celebration slow you down. I know you managed to post more stories on the website today than I did. Anyway, happy birthday, Alfred, and hope to see you soon. Our big story for today is that clinical trial that was announced by the Alberta government for the anti-malaria drug, hydroxychloroquine. I'll have more on that in a moment. I first of all just want to look at the numbers here in Canada. Numbers-wise, we're at about 25,500 cases, 780 deaths across the country. In my neck of the woods in Alberta here, another one, 81 cases reported in the last 24 hours. We're up to just over 1,746 deaths. But a bit of an observation here when you look at the numbers and all of Canada. You see this huge concentration in central Canada, in Ontario and Quebec. 80% of the cases are in those two provinces. It's almost like two countries, the way this pandemic is playing out in Canada. Hospitalization and infection rates are lower outside of those two provinces. Here in Alberta, of course, we had a little more lead time to get prepared. But also in Alberta, public health officials didn't play around. They got tough very, very quickly. And at least for now, those results are paying off. And something else that is happening here, of course, is, like I said, we're launching that clinical trial. Now, hydroxychloroquine was originally an anti-malarial drug, and they still use it, but mostly for disorders like rheumatoid arthritis. However, laboratory studies have suggested it might be helpful against COVID-19, not a cure, and this is what researchers are looking at here. Not a cure. They're wondering whether that 5-day treatment of the drug could lessen the symptoms for those at highest risk. So an elderly person who might have COPD or something, who's at a high risk of dying from COVID-19, if he was on this 5-day course of treatment, would it lessen the symptoms and perhaps even allow him to manage his disease at home instead of in the hospital? The clinical trial will, they're looking for about 1,600 volunteers right now, and it'll be done by researchers from the University of Calgary and the University of Alberta. Now, our Chief Medical Officer of Health, Dr. Dina Hinshaw, says the province is also expanding testing for COVID-19.
Immediately, we are expanding eligibility for testing to anyone in Alberta who has a fever, cough, shortness of breath, runny nose, or sore throat. If you have any of these COVID-19 symptoms, it is important to remember the critical first step. Stay home if you're sick. Your next step should be to take the AHS online assessment form in order to arrange testing.
So we're going to have a lot more testing, and Hinshaw says that's going to reveal a lot more cases, but she says don't worry about the rising numbers.
I know seeing this increase in numbers may be a concern to some, but it's important to remember that the number of daily confirmed cases as a percent of the tests done every day has remained approximately similar through the past several weeks. When we look at the provincial numbers by the date the swabs were collected, the percentage of tests that have come back positive has been approximately 2% for the past several weeks. This indicates that the rate of infection has remained relatively stable over the last while.
So again, don't worry about the increasing number of cases. They were there all along. We're just revealing them faster. Oh, and one other thing, golfers are going to have to wait. Don't be calling up the golf course trying to get a tee time. In response to an online petition from a bunch of golfers in Calgary, Hinshaw, she says she's not going to open up the golf courses. She says they're not essential. That petition says golf courses should be exempted from the public health order because, you know, people can exercise and so on. Well, you can do that in a gym too, but we're not supposed to be crowding together right now. So the health order still stands. Golf courses are closed. That petition, incidentally, only got about 1,600 supporters. 1,600 people in a province of 3.5 million? Pretty small minority there. I wish you all good health. Take care of others. Take care of yourselves. Stay home. Stay safe. And stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.
Thank you, Thomas. Thank you, Thomas. And thank you for emphasizing about the testing. You know, it's good for us to know the numbers because that will tell us, you know, tell the local government and also the health officials where this virus, what the virus is doing. And speaking of the drug, the hydroxychloroquine, that is the same drug that President Trump was talking about, correct?
Yeah. He's been pushing FDA to approve it for treatment of coronavirus. And again, it's not really a cure, but it can lessen the symptoms. And if you lessen the symptoms, then I guess with symptomatic treatment, a person's got a better chance of surviving. The idea of using the drug here in Alberta is that if you also lessen the symptoms, people can recover at home. And when they're at home, that frees up a hospital bed for somebody else who needs it. We're putting less pressure on our hospitals because we don't want to end up in a situation like some cities like New York and so on, where literally there's just no place to put people.
So would you say that that's the main goal of the clinical study? To lessen
That is the main goal, is again, because it's not going to cure coronavirus, but it's going to lessen the symptoms. And like I say, at that point, you can manage it at home as sort of a mild case of the flu instead of something very serious where a person is going to end up on a ventilator.
Well, hopefully that clinical study will tell us more as you know, as it goes, because these studies, the downside of it is that, you know, it really hasn't been a lot of time to do them. So, but thank you so much, Thomas. We'll see you again next time.
Thank you, Anna.
President Donald Trump says he has the authority to reopen the economy, but the governors of Maryland and Virginia might have a different view. May Bondoc Ramos reports in Washington, D.C.
Thank you, Anna. Before I give you the details of my report, let me update you first with the current number of COVID-19 cases here in the DMV area, that is Washington, D.C., Maryland, and Virginia. The total number of confirmed cases surged to 16,638 today. In Washington, D.C., the cases are steadily increasing with 1,955 and 52 people have lost their lives. Maryland has set up the government website to include numbers by zip code to easily know where the hard-hit areas are, since the positive cases reached to 8,936 with 262 fatalities. Virginia, on the other hand, has 5,747 recorded cases and 149 deaths. See, Anna, just earlier today, President Donald J. Trump stated that reopening the economy is a decision of the president and not of the governors of each state. President Trump tweeted, as I quote, "It is the decision of the president, and for many good reasons. With that being said, the administration and I are working closely with the governors, and this will continue. A decision by me in conjunction with the governors and input from others will be made shortly," unquote. The governors of the states disagree with the president on who makes the decision of reopening the economy, especially when it relates to their home state. Maryland Governor Hogan told CNN's Anderson Cooper in an interview that governors are the ones who would decide when to reopen their states. In Virginia, during his regularly scheduled press conference, not paying attention to what President Trump was saying, Governor Northam said, as I quote, "As of right now, we are looking at our peak being in the latter part of April, early part of May. So we will extend that order for people to not go into businesses like that those businesses will be closed," unquote. The debate between the president and the governors as to who has the ultimate authority to reopen the economy might not be easily resolved. But it's clear that what's on people's minds, especially our elected officials, is how and when we can get back to work and reopen the economy. The specifics and time frame have yet to be provided by the White House. Speaking about reopening the economy, let us listen to what President Trump said on his April 10 press conference.
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well. We're doing it looks like we're at the lower end of the curve in terms of death, which is a terrible word, a terrible dark word that we've experienced like nobody's ever seen before in this country. I mean, we're
So it is indeed a strong feeling. In line with this, the president also mentioned that he is forming another task force to deal with the economy. Though no official name was given, he mentioned that the task force could be called the Opening Our Country Task Force or Opening Our Country Council. Well, all of us are eager for the economy to reopen, for businesses to reopen, and for everyone to get back to work. You know, everybody wants the economy to succeed. Hopefully, the president and the governors of each state, and with the input and advice of our nation's health officials, can work together and come up with a plan that would allow us all to safely return to work and for us to patronize our favorite restaurants and businesses. President Trump also said on April 10 in his press conference, as I quote, "I have a big decision coming up, and I only hope to God that it's the right decision. But it'll be based on the input from a lot of very talented people, very smart people, and people that love our country," unquote. This is indeed one of the biggest decisions that the president has to make during his tenure. Let's hope he makes the correct one. In Washington, D.C., May Bondoc Ramos, Eagle News, we live in interesting times.
Thank you so much, May. Well, you know, for us, and hopefully we'll send this message to everybody, that no matter what, we will just follow, whether it is from the president or local government, wherever we are, right? That's the important message that we can share with everybody, just to follow whatever directives that we will receive going forward. So this new task force you mentioned, do you know who will comprise this opening the economy task force?
Well, President Trump said in a conference, I will just quote from the press conference, "We're going to have the great business leaders, great doctors. We're going to have a great group of people." There are actually hints and rumors of these people. But by Tuesday, President Trump will announce who will be on this task force. So definitely, I will update you about it. If it's tomorrow, I will update you tomorrow.
Well, thank you so much, May. I'm sure we will hear from you again, and thank you for always giving us the updates.
Thank you for having me.
Internet and phone providers in New Jersey are prohibited from cutting off services until 30 days after the COVID-19 crisis. Mayan Mazano-Guerzon in Sicklerville, New Jersey, for the details.
Hi, Anna. Starting first with the overnight numbers of New Jersey's COVID-19 related cases as of April 13. Total of 64,584 New Jerseyans tested positive and 3,219 new cases. 94 recorded new deaths with 2,443 total fatalities. The number of cases recovered or discharged today is 556. Governor Phil Murphy, in his daily press briefing, urged everyone to continue practicing social distancing and to keep working together to flatten the curve. Now onto the headline, internet phone providers prohibited from cutting off services until 30 days after COVID-19 crisis. Internet and phone services are not allowed to shut off, reduce, or disconnect services to New Jersey residents during this time of pandemic under the new executive order signed by Governor Phil Murphy on Monday. The same order also prohibits those providers to downgrade their services and charge late payment fees. Murphy also ordered a reconnection of any internet or phone service that was disconnected due to non-payment after March 16. I am doing this for a simple reason. People actually need to stay connected. This is no time for anyone to have their connection to the world suffer, Murphy said at his daily press briefing on Monday at the Trenton War Memorial. He also said that New Jerseyans need to be connected for online learning, for work, and for communicate with family members. Murphy added that some providers had already been doing this voluntarily, but this executive order will force all of them to do what's right and get them to the program. The said order protects customers until 30 days after the current public health emergency has ended. Now, in relation to this order signed by Governor Murphy in favor of New Jersey residents, here are the other types of benefits or assistance that are available to New Jerseyans during the coronavirus outbreak. as published on covid19.nj.gov, amongst others, health insurance. If you do not have health insurance or lose coverage, you may be eligible for free or low-cost coverage through New Jersey Family Care. There is also food assistance. If you need food assistance, you may be eligible for New Jersey's Food Assistance Program. Also, cash assistance, Work First New Jersey, which includes temporary assistance for needy families, and general assistance provides monthly cash. And also eviction protection. During the public health emergency, individuals cannot be removed as the result of an eviction or foreclosure proceedings. Mortgage relief, if you are facing economic hardship as a result of COVID-19, you may be able to request mortgage payment forbearance for up to 90 days. And lastly, child care resources. If you are an essential employee, you can get support for child care costs. To learn more about these benefits, visit covid19.nj.gov. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News. We live in interesting times. Anna?
Thank you, Mayan. I was wondering, you mentioned that, 30 days after the COVID-19 crisis. Now, what date are we looking at for New Jersey? Is that?
Hi, Anna. There was actually no mention of the date where this crisis will end. No one will, I believe no one knows. So that's why Governor Murphy in his briefing today just mentioned that once this has ended, this public health emergency is ended, then the customers or users are given 30 days to pay for any balances when it comes to phone and internet services.
Thank you for that.
Anna.
Now, in addition to, besides the United States, which countries do you know has the most positive cases?
Yes, Anna, in New Jersey, there are actually 29 counties, and the top 5 counties of New Jersey who has the most number of positive cases are Bergen, Hudson, Essex, Union, and Middlesex. These are also the counties, Anna, I believe that this is very important to mention, that these are the counties that are in the northern part of New Jersey and are very close to the state of New York.
I'm wondering, what's the percentage of deaths in terms of race, ethnicity in your area in relation to positive cases?
Yes, Anna, that's very interesting because that was actually also mentioned in the press briefing today by Governor Murphy. According to State Health Commissioner Judith Persicelli, in terms of the ethnicity or race for the deaths, the number of deaths of the COVID-19 related cases, whites, non-Hispanic is 51.2%, Black, non-Hispanic is 21.3%, Hispanic 18.6%, Asian 6%, and others 2.9%. Given these percentages, Anna, Governor Murphy reiterated that this pandemic is not a matter of race, it's not a matter of ethnicity, it's not a matter of social status or whatsoever. Thus, he continues to encourage everyone to just stay home and to protect yourself from the virus. Anna.
Thank you so much, Mayan. That is so true. Again, it's a reminder and it's a message to everyone that this virus does not discriminate. Thank you for that report. The governor announces that the Georgia World Congress Center would stage additional 200 beds for mild to moderate COVID-19 patients. Philip Toledo reports in Atlanta, Georgia. Philip?
Thank you, Anna. As of this evening, the Georgia Department of Public Health is reporting 13,621 confirmed cases of COVID-19 and 480 deaths in the state. So if you compare that to the other states in the United States, that ranks Georgia about 11th in terms of total cases. Now, as the numbers have steadily been increasing, we're on track for a projected peak of cases and hospitalizations on April 26th, which is approximately 2 weeks from now. In order to prepare for that, Governor Brian Kemp announced yesterday that the Georgia World Congress Center would be used to stage an additional 200 beds for mild to moderate COVID-19 patients. These are patients who are ill and need additional care. They can't be at home, but not those that require the services of an intensive care unit or a ventilator. Now, the Georgia World Congress Center, just to give you some context, is right in the heart of downtown Atlanta. And normally it's being used for major conferences, huge events, like last year when the city hosted the Super Bowl. The Super Bowl Experience exhibit took up the whole ground floor of that facility. But now it's going to be modified with the help of the Georgia National Guard and other agencies to be prepared for a surge of COVID-19 patients. Governor Kemp also mentioned in his press conference today that it could be expanded up to 400 beds as needed. Now, all of this is happening right in the aftermath of a series of serious and deadly storms that passed through the southeastern United States last night. Unfortunately, here in Georgia, we weren't spared from experiencing this. In the northern part of the state, several properties were damaged, and unfortunately, there was loss of life. Now, in spite of all of this that's going on, Georgia residents, especially here in Atlanta, are doing their best to remain hopeful and united. This past weekend, to show solidarity and support with our frontline and essential workers, many major Atlanta landmarks were lit up blue as part of the Light It Blue campaign to show support for those workers. So it just goes to show you that even though many people may be worried about the things that are going on, these types of events really are bringing out the unity and the support of one another in this city. In Atlanta, Georgia, I'm Philip Toledo, Eagle News. We live in interesting times.
Thank you, Philip. Wow, a series of storms along with the pandemic that's going on. Can you tell us personally, how did that feel for you?
Well, I'll tell you, I didn't get much sleep last night, Anna, because I do have a young son and we don't have a basement in the house that I live. So, I feel like I was waking up every few hours to check, the COVID-19 updates, but also the progress of the storms that were coming through. But it's important. It was an important reminder, too, that just because we have this pandemic going on, it's not stopping all the other things that normally happen through the course of life, like, natural calamities and disasters like this. In fact, in one of the things he mentioned in his press conference today, the governor of Georgia, that across the state, hospitals are making preparations to add more flexibility, to add more beds as different things happen aside from just COVID-19, which really highlights the importance of that flexibility in our healthcare system.
Well, thank you so much, Philip, for that report, and we wish you and your family and everyone there well, and hopefully, they can move on from the storms as well. Thank you.
Thank you, Anna.
Louisiana residents were hit not only with rising coronavirus cases, but also with several tornadoes impacting the northern part of the state. Nicole Padilla in Baton Rouge reports.
Thank you, Anna. As of today, the number of confirmed cases in Louisiana are at 21,016, with a total of 2,084 patients hospitalized, among which 458 require ventilation. Of the 884 COVID-19 related deaths, the top 3 underlying conditions are hypertension, diabetes, and chronic kidney disease. Just this past weekend, the governor ordered flags to be flown at half-staff in respect for Representative Greg G. Bagalo, who passed away from COVID-19 on Thursday and had represented the people of House District 54. Here in Louisiana, residents were hit not only with rising coronavirus cases, but also several tornadoes which impacted the northern part of Louisiana. Governor John Bel Edwards declared a state of emergency on Sunday following a severe storm system that produced heavy rainfall, 60-mile-per-hour winds, 2-inch diameter hail, flash flooding, and several tornadoes, which touched down in the southern states. While no deaths were reported from the tornadoes in Louisiana, a number of parishes sustained damage, including airplanes and hangars at Monroe Regional Airport. The governor declared the state of emergency to make sure that any affected parishes or areas received help from the state and encouraged the public to stay weather aware by monitoring local media for weather information. In Baton Rouge, Louisiana, I'm Nicole Padilla, Eagle News. We live in interesting times.
Thank you, Nicole. Can you tell us the extent of the tornado damage even from where you are?
The storm had damaged between 200 to 300 homes in and around the city of Monroe. However, here in Baton Rouge, where I live, we were not impacted that much. Ironically, the weather just turned a little cooler, but thankfully this area was safe. As for my family and we have been staying home, discovering new recipes to try.
That's good. Always finding something positive, something that we can, take our minds away even for a few minutes from what's going on around us. Thank you, Nicole, for that report. Washington, California, and Oregon officially unified their collective coronavirus responses with Governors Jay Inslee, Kate Brown, and Gavin Newsom announcing a tri-state pact Monday. Michael Hudson in Seattle with the details.
Hey, how you doing, Anna? So before I touch upon the main story, I just want to share with you some stats from the state of Washington. So as of today, there are slightly over 10,000 positive cases for COVID-19 and just over 500 deaths. So as we can see, though the curve is flattening a little bit, we are still seeing, unfortunately, some deaths in the state. But to go to the main topic of the story is the states of Washington, California, and Oregon have decided to make a tri-pact. And the reasoning behind that is to be able to speed up getting the economy back on track and reopening the businesses. As most of us know already, the date of going back into business is May 5th. And so they're looking to establish some measures in order to make that happen. The main reason, one of the other main reasons for them to make this tri-pact is they want to make sure that the residents' health is always going to come first, and they're going to base this on science. So they're really going to lean on the public health officials' knowledge and expertise when it comes to the virus. As I got from the governor's website, the 4 primary goals is 1, protecting vulnerable populations at risk for severe disease if infected. This includes a concerted effort to prevent a fight of outbreaks in nursing homes and other long-term care facilities. Number 2, ensuring an ability to care for those who may become sick with COVID-19 and other conditions. This will require adequate hospital surge capacity and supplies of personal protective equipment, or PPE. Number 3, mitigating the non-direct COVID-19 health impacts, particularly on disadvantaged communities. And lastly, number 4, protecting the general public by ensuring any successful lifting of interventions, including the development of systems for testing, tracking, and isolating. The states will work together to share best practices. So as you can see by these goals, these 3 states are going to be in constant collaboration to ensure that the residents are safe from right now's virus and also from future outbreaks, and also bringing the business back up to speed. And I'm hoping that this will inspire other states to unify, because I think at the end of the day, being unified and defeating this thing is really going to speed things back up and bring things back to normal. Reporting from Seattle, Washington, I'm Michael Hudson, Eagle News. We live in interesting times.
Thank you, Mike. That's a really good point you bring up. Right now, it's looking at what's working in neighboring state maybe can be applied in another state. So it's really good that they're collaborating. But you mentioned May 5. That is, I believe I heard that from the president, correct? Mm-hmm. So that's less than a month away. Mm-hmm. What's your prediction? I mean, if you were to give your personal prediction, when Washington State will open business, what do you think?
I'm an optimistic person in general. So, I mean, obviously, I would love to see May 5th. But in the back of my mind, I think it's going to be longer. The reason why I say that is because you see the numbers. They're not, I mean, they're getting better, but I mean, they're still pretty high as far as the virus still staying prevalent within the communities. But if you were to ask me, I would say probably later in the summer. So I'd probably say July would be my guess as to when everything comes back.
Yeah, that's pretty much what most people are saying as well. Now, the measures that you mentioned, do you think those are enough to spread in the future?
I think they are, because I think they have the residents in heart. So I think those measures are really going to cover all the bases as far as making sure that the businesses are operating on an optimal level, as far as keeping the hygiene to a high capacity.
Well, thank you so much, Mike, for joining us, and we'll see you again next time.
You bet. Thank you.
Los Angeles Eric Garcetti announces the Los Angeles Emergency Child Care Connection and the Critical Care Delivery Service Program. What are these? We have Glessie Magaling in Los Angeles with the answer. Glessie?
Thank you, Anna. As of today, the Los Angeles Public Health Department announced a total of 9,420 positive cases throughout all areas of Los Angeles County, with 320 deaths. Recently, Los Angeles Mayor Eric Garcetti announced 2 programs launched to support Angelenos during this difficult time: the LA Emergency Child Care Connection and the Critical Care Delivery Service Program. LA Emergency Child Care Connection is a child care program that will provide resources for essential healthcare workers who are currently working to battle this virus on the front lines. With the increasing cases of this virus, hospitals and medical centers are preparing for the peak that is projected to happen this week. According to Garcetti, hospital workers are making incredible sacrifices every day to keep Angelenos healthy and save lives, said Mayor Garcetti. We have to take care of those who are taking care of us, and this program will help ensure that they have needed support to take care of themselves and their families. LA Emergency Child Care Connection is an initiative through the Department of Recreation and Parks and the Mayor's Fund for Los Angeles. This program will consist of 3 components: a $100 stipend per shift for hospital employees to use for their preferred means of childcare. Also, free childcare referrals to licensed providers in their community, and city recreation centers near participating hospital providing free childcare for children between 6 to 14 years of age. The first hospitals to participate and pilot this program are White Memorial, Northridge Medical Center, and California Medical Center. The Critical Care Delivery Service is a program launched by the LA County Workforce Development, Aging, and Community Service. This is a temporary delivery program for those dependent or older adults who are unable to leave their homes and are in need of groceries, household supplies, and vital items. In order to qualify for these services, one must meet the following criteria: 60 plus years of age, is a dependent adult 18 to 59 years of age, or an individual with a temporary or permanent disability. Deliveries must be scheduled Monday to Friday, 8 a.m. to 5 p.m., and can be delivered to these individuals 24/7. Deliveries can be requested by calling 888-863-7411 or online. 4 deliveries or 40 miles worth of deliveries are available per month to each participating individual. In Los Angeles, California, Glessie Magaling, Eagle News. We live in interesting times.
Thank you, Glessie. And those are really good measures, to support our frontliners, because we don't know their situation, right? I mean,
Right.
They may not have anybody to support them, especially in caring for their kids.
Yes.
So we do live in a very stressful time for everybody. Now, what about you? What outlet do you have or that you're doing to manage your stress?
You know what, Anna? Even before the coronavirus pandemic, coming home to my dog Chloe and playing with her always helped me take the stress away. And on top of that, I'm also trying to do some at-home workouts so I can stay physically active during self-quarantine.
That's good, because keeping healthy will help us fight the virus better. So keep up with that. Thank you.
Thanks.
Hospital capacity in San Francisco shows a promising sign with available hospital beds staying around 45%. Rachel Ann Martin in San Francisco has the details. Rachel Ann.
Thanks, Anna. Hi, thank you. The San Francisco Bay Area is almost a month into the shelter-in-place guideline, and the results so far look promising. Over the last 5 weeks, close to 8,000 tests were conducted with SF residents, with only 13% testing positive. Since April 6th, the total suspected COVID-19 patient count in San Francisco has dropped significantly from 122 all the way down to 44. All the work that everyone in the Bay Area is putting in, from our healthcare workers risking their lives for us to all the residents of the Bay Area staying home, appears to be working. Hospital capacity in San Francisco continues to be a promising sign, with available hospital beds staying available around 45%. And in other parts of the Bay Area, companies are continuing to show empathy to employees and their communities alike. Also, Google announced a partnership with Apple on a COVID-19 contact tracing technology. Part of the company's announcement stated, and I quote, "Since COVID-19 can be transmitted through close proximity, public health officials have identified contact tracing as a valuable tool to help contain its spread." The partnership is continuing to show that though companies may be competitors for consumers, when you're talking about a global pandemic, differences can be put aside and strengths brought together for the greater good of humanity. In San Francisco, California, Rachel Ann Martin, Eagle News. We live in interesting times.
Thank you, Rachel Ann. I think San Francisco was one of the first few states that went into lockdown. Can you tell us how are things there now, where you live?
Yes, actually, of course. Yes, actually, I am currently staying in South San Francisco, so it's a little bit outside of the inner city, or out of the main city. In my area, everyone has been respecting the CDC guidelines for the shelter-in-place and social distancing in the community. And honestly, every day you can see this visibly in the local grocery stores. People wearing masks, face masks, helping sanitize like carts and baskets, and also trying to keep the appropriate distances. One of the common things that I've been also noticing is seeing more people finding ways to stay healthy at home, in the safety of their own home. And occasionally, when the weather's nice, you see others going outside, taking a run or a walk, still keeping appropriate distances, but still being able to stay healthy in this time. So let's stay safe, stay home, and stay healthy.
Thank you, Rachel Ann. Thanks for joining
us
Anna.
Tonight. Thank you.
Coming up, an occupational therapist in Orlando, Florida will tell us how she checks up on her patients without leaving home. COVID-19 coverage continues. This is Eagle News.
This program is co-presented by Kubert Industries Incorporated, Electromechanical Trading and Services, The Cooling Expert, Vita Herbs Philippines Green Coffee, Masarap, Mabango at Healthy Pa, Cadrid Corporation, your ventilation and air conditioning specialist. In participation with Rain or Shine Elastomeric Waterproofing Paint, color for protection for your home. Matimco. Matimco is wood. Wood is Matimco. Our Square Variables Incorporated, your trusted UPS supplier and UPS maintenance provider in Luzon, Visayas, and Mindanao. CompuZell Computer Services, ID card and lanyard manufacturer. DN Steel. EMAC, UPVC Roof Corporation.
You're watching the ABC international coverage of the coronavirus COVID-19 pandemic, North America edition. I'm Anna Kui in Las Vegas, Nevada. COVID-19 has definitely redefined patient-doctor or patient-therapist interaction. In recent days, shifting medical resources and focusing immediate attention of healthcare workers to those infected by the new coronavirus and those considered urgent patients are ways of triaging effectively in a pandemic. So, if you fall under the non-urgent patient category but wish to consult your healthcare provider or continue with your therapy, you have a choice to connect with them via what is called telehealth services. Joining our broadcast tonight is a pediatric occupational therapist in Orlando, Florida, who will share with us how she still manages to see her patients, who she says she misses a lot amid the virus scare. Thank you, Melissa Potes, for joining us tonight.
Hi, Anna. Thank you so much for having me.
First, let me greet you a happy Occupational Therapy Month.
Thank you so much. Yes, April is Occupational Therapy Month, so it's good to be on the show this evening.
Okay. So tell us, you've been a pediatric occupational therapist for almost 18 years and in home health going on 4 years now. Explain to us the nature of your work and why did you choose this career path?
Well, occupational therapy work with individuals across the lifespan, helping them to engage in meaningful activities. So for me in pediatrics, I help children with their occupation of playing. So play and activities that they need to be able to be successful at school and at home are the main focuses of my therapy services. When I first started going to school, I knew I always wanted to work with children. I initially wanted to be a pediatrician, but that changed my sophomore year of college. I knew that wasn't going to be the path for me. So I really was actually going to be either a nurse or a teacher. And my mom, who is a home health nurse, was working at the time at the hospital for University of Pennsylvania. And she arranged for me to meet with an occupational therapist to shadow her for a few hours. And I ended up really enjoying the work that she did. At the same time, it just coincided with my school had just opened a occupational therapy program. So I applied for the program, got in, and I graduated. We were actually the third graduating class for occupational therapy.
You mentioned children. You work mostly with children. Is that correct?
Yes, so I do a pediatric population. So I work with children from birth to the age of 21. Most of my children are diagnosed with developmental delays, neurological difficulties, learning disabilities, and behavioral issues.
How has the COVID-19 pandemic affected your work?
Well, when the COVID-19 was initially, everyone was starting to talk about it, I still was going into patients' homes. I knew I was following standard precautions. I was doing everything in my care to make sure that my patients, their families, and myself were all safe. But as the number of cases increased in the Orlando area, the zip code that I actually live in and treat in mostly is actually considered a hotspot for COVID-19. I had to rethink about the best way to reach out to my patients to make sure that I was safe, my family was safe, as well as their families were safe. So around the same time, President Trump had mentioned that telehealth was an option for Medicare patients. And looking into the Florida Medicaid program, they actually were allowing telehealth visits as well. So I started doing telehealth visits with the majority of my patients towards the end of March.
Was the transition, okay from the in-person to telehealth? Because I know, even though the president did announce it, were there any challenges that you faced? Was there a delay as far as, starting with the telehealth services?
As long as I spoke to my families and I was able to get consent from them, we were able to go right into treatment sessions. I really focused on using either Zoom, or a lot of them are using FaceTime, whatever was most appropriate and easy for them to access. So I was really able to make that transition pretty quickly.
Were there any challenges with the families, getting on Zoom, or can you walk us through how you started with that?
So some of the families had issues trying to log on, trying to time it correctly, make it work with their schedule. Typically, sessions last from 45 minutes to an hour. And I think the greatest challenge that I've had with treating my patients is handling some of the behavioral issues, trying to make sure that the children are focused and engaged, really having to rely on the parents to help me, more so than usual, to really keep them in check. I had one today who kept putting a piece of paper up to the camera and covering their face, and I'm like, put it down, I can't see you. So just things like that. And for me, I've been trying to use behavioral strategies to address that. Token systems, letting them earn 5 smiley faces or stars, and at the end of the session they get to earn a preferred activity, and today it was ABC Mouse. So
I know a couple of teachers who also work mainly with with children who have behavioral disorders, and as well as physical challenges. Would you say that now, because of this, one of the positive things is that the parents are more involved?
Oh, most definitely. They're always there at the homes when I was treating, but now they're actually sitting in on the session. They're sitting right next to them, making sure that they're staying focused, making sure that they're engaged. So then they actually know what goals we're working on, so that they can just follow up on the days that they don't have therapy sessions.
That's great to hear. So what do you miss most about, seeing your kids in person?
I think being able to give them like the high fives and the hugs is the thing that I miss the most. It was cute because one of the first sessions I've had with a lot of the kids, this is the first time that they were seeing me through Zoom or through FaceTime, and you could just see their faces, like light up, like, oh, we know her. That, and I don't know if they were interested in just watching themselves on the camera as well. But really being able to interact with them in that way, I think, is what I miss the most.
And you're a parent too, so how has your children dynamics changed since the pandemic?
I wouldn't say that my dynamic has changed that much. Our kids are doing distance learning, so for one thing, I am definitely more lenient when it comes to their schoolwork. I understand it's a big transition for them, for any of these kids that, going to school and now having to work at home and then doing everything on the computer is a challenge for them. But really, we've just been trying to spend more time together as a family. We have game night almost every night. My 5-year-old needs a little bit more attention, so trying to keep him happy and active and engaged. So it's a little bit more challenging with him. And then just for me, just trying to find the time to take care of his schoolwork and take care of the kids, as well as trying to treat my patients.
Now, do you feel, Melissa, that it's more challenging to do, of course, it's probably more challenging not to be there in person, to see your kids. Can you tell us, what other challenges you're having doing telehealth services?
I think that doing therapy in this way has really caused me, or had me really try to think outside of the box, trying to be really creative to try to find activities that engage them. Typically, I have games for turn taking, and they can press the pig's head down and do all of that, and I'm doing that instead, but still trying to keep them engaged. So doing those kinds of activities where, they're being able to be a little bit active while also addressing their goals.
So that's good. Even with the challenges, there are positive things that are coming out of it. Like you mentioned, thinking outside of the box. That seems to be the trend with everything. We become more creative, right? So what would you change, if there was anything that you can change about what you're doing? So many. I could sense in your voice that there's many things that you'd like to change.
Well, I think the biggest thing that I would change was if it was safer for me to be able to actually go see my patients. I have about 6 that I'm not seeing just because of their functional level. They need more assistance with positioning, and to provide them therapy services through telehealth just wouldn't be an appropriate means. So if I was able to actually go out and see them, making sure that their families are safe and my families were safe, I think that would be the biggest thing, is that I would be able to reach all of the kids on my caseload. Right now I'm seeing about 60% of my caseload.
Well, keep that passion, Melissa, because you are making a difference. I'm sure the parents of their children, really do appreciate everything that you do for them. If there's anything that you want to add, maybe from the parents, what kind of things are you hearing from them?
I've only gotten positive feedback from all of the parents that I've worked with. And for parents that are out there who do have children that get therapeutic services, if you haven't tried telehealth, give it a try. You're not going to know if your child's successful until you try it out. The most important thing is that we continue to provide them services through this epidemic, because it's going to help them keep normalcy to their routine. Some of these children have been receiving therapy services since they were very young, and so to stop therapy completely is really a risk for them to regress. So whatever that we can do to try to provide services for them, give it a try and let's see if it's going to work for them. You're never going to know unless you do try it.
Well, thanks, Melissa. We wish you the best, and we're glad that you're still able to get help to the kids, even though you're connecting with them virtually. So we wish you the best, and keep it up and stay safe.
Thank you so much.
Coming up, a couple in Phoenix, Arizona shares with us how the pandemic changed the way they spend quality time. Stay with us.
This program is co-presented by Kubert Industries Incorporated, Electromechanical Trading and Services, The Cooling Expert, Vita Herbs Philippines Green Coffee, Masarap, Mabango at Healthy Pa, Cadrid Corporation, your ventilation and air conditioning specialist. In participation with Rain or Shine Elastomeric Waterproofing Paint, color for protection for your home. Matimco. Matimco is wood. Wood is Matimco. Our Square Variables Incorporated, your trusted UPS supplier and UPS maintenance provider in Luzon, Visayas, and Mindanao. CompuZell Computer Services, ID card and lanyard manufacturer. DN Steel. EMAC, UPVC Roof Corporation.
This is the ABC international coverage of the coronavirus COVID-19 pandemic, North America edition. Anna Kui coming to you from Las Vegas. Now, COVID-19 has forced many changes to our way of life, how we work, how we learn, even how we protect our homes and loved ones. And while change can be hard and stressful, it can also result in blessings we never anticipated. Take a look.
Neil and Krista Cruz, like many young couples today, followed a very common life path. They met, fell in love, got married, and worked to build a comfortable life together. Neil, a scrum master with Charles Schwab, and Krista, a registered nurse at a local hospital, could have happily followed their set path for decades more. But instead, the COVID-19 pandemic set into motion changes in how they work and live. Neil was forced to work from home. Krista was forced to rethink her safety routines, since her work at the hospital put her and her household at higher risk for infection. Together, they developed a plan on how to be productive, safe, and yes, even what to do should one or both of them get sick. Neil admits working at home makes him more productive work-wise, but also more neglective of his physical health. Krista says the landscape at the hospital has changed drastically in the past month as they deal with shortages, training, and the need to keep families updated about their loved ones in isolation. But as the days progressed, they began to realize that something new was developing in their lives. A keener awareness of time and the value of time spent. Krista has to remember Neil is at work even when at home, and spends her days off creatively, painting and designing home projects. But when Neil gets off from work, the two have found themselves in deep discussions regarding life changes, braving necessary trips together, and finding deep appreciation in all things, especially in the moments they spend together. So while they still protect themselves from the devastation COVID-19 can bring to their doorstep, they can't help but be grateful for the deeper appreciation for strength, faith, and hope it's fostered in their everyday moments together. Phoenix, Arizona, Lisa Docena, Eagle News. We live in interesting times.
That was truly inspiring. And we actually have Neil and Krista Cruz with us today. Thank you for joining us, Neil and Krista.
Good evening.
Thank you, Anna, for having us.
That was really nice. I bet it's hard, Krista, for you to, to go to work and Neil is at home, even though he is working, right?
Oh, yes. I have to remind myself that, he's home. He's working. So it's a change.
Yes, it's a change, definitely. But for our viewers, what were the hardest changes or challenges each of you faced in adopting this new lifestyle?
Well, for myself, with the social distancing in effect, one of the things that we don't get to do now is see friends or hang out or even sit down at a restaurant. We don't realize how much we like doing that or appreciate that until, of course, it's taken away. Around this time, we were actually planning to go on a trip, visiting a different country. So, of course, we had to give that up. But at home, it's easy for me to go to work, to log in in the nearby bedroom. But I have to make that mental effort, focus on work, don't just go back to sleep or along those lines. And at the same time, there's always these distractions, updates, constant updates, news flurries about the COVID-19 situation all around the world.
And for myself, I agree with the social aspect part about going out. We have to change how we go out and what we do when we go out. And then another challenge is coming home from work and just having that worry at the back of my mind that I might have been re-exposed again, or I have brought something home from where I work.
Yeah, that must be a challenge. Now, I know we've heard from other frontliners as well. Do you have a routine, Krista, that you do when you get home?
Oh, absolutely. And Neil has helped me make a very good routine as soon as I come home, stepping out from my car to getting to the washer and just putting my dirty uniform there, especially if I've been exposed or taking care of someone in isolation. And then we do have a stock of sanitation supplies.
Now, the feature said that you guys developed a plan, even for when you get sick, even if hopefully you won't, but you do have a plan in place. Can you share with us what those plans are?
Well, to start off, we've made a good habit of making sure we're stocked with groceries for at least 2 weeks. Of course, we have this necessary supplies, toilet papers, napkins, Clorox, bleach also. So if we need to actually self-quarantine, we have the things needed to survive for at least 2 weeks.
And I've made an emergency kit per se. I have a temperature probe, a pulse oximeter ready to go, and we have a stash of Tylenol and ibuprofen in case of a fever. And from what I've learned from work, I bring home and I share it with Neil to kind of pinpoint those symptoms that are different from COVID versus allergies and a mild cold. So he kind of knows what the difference is, what it looks like.
So he's in good hands. Actually, it's probably, there's a downside of being a nurse, because like you go home and you probably maybe sometimes will whine about a symptom, and you probably tell him, don't worry about it. I've seen that. It's not what it is. So
Yes.
in a way, it doesn't help him that you're a nurse. Now, tell us, Krista, how about creative projects? How do you decide what to do? And does Neil help them? Does Neil help with them?
Well, Neil is a very great supporter of all my hobbies. I do have multiple projects, sometimes multiple ones at the same time. I kind of think of it as a grand scheme of an idea, and so when I put it all together, it's to make a comfortable space. I mean, I have areas about the house that I want to fix up. Example, I do floral arrangements. I do my paintings. I've made a portrait of my husband finally. And so just having that time here, I can make like family portraits and then redecorate part of the house, part of the tiny patio we have. We live in an apartment complex. And then, a little bit of like trying my hand at gardening and stuff, because, why not? We're going to the grocery stores all the time. And yeah, so doable, realistic, short activities are good.
Wow, you are so talented, so creative. What's the inspiration besides Neil?
Well, before he came along, I usually, I've grown up to do a lot of artwork. Like I've been drawing since I was 5. And so I have many paintings around the apartment. I finally hung it up when I got married. And then I love to do a lot of activities with my hands. And so I do like to try myself at photography, or, I picked up floral arranging last year. I took a class for it. And so putting it all together, it's like I've actually, I'm trying to make a home. So at the same time, it's a collaborative effort too, because Neil has hobbies that he's a tech guy. So if I would like music, he would help me set that up. He would help me hang all my work because I'm height challenged. He knows how to make things more organized, and he'll give constructive criticism on how things should look. So we kind of work together that way.
That's good. So there's a balance. Now, what would you say to those our viewers who are thinking into venturing into being creative also? What would you say to them, and why it's important, especially in this times?
I say go for it because we want to stay productive. We want to enjoy the things that we have the order. You're gonna feel good. You're gonna feel good. More time we have to work more on these projects, these passions, and when we get to complete them, again, we feel proud of our accomplishment. We feel enhanced that we
honed in our skills.
It's definitely enriching. It's an experience that you'll be proud that you did. And there's so many activities that you could do with your families too, like try a new recipe, go out for a stroll with your pets, make a craft night with your kids, catch up with a movie, and make those moments count while you're home.
You also mentioned that you appreciate moments with each other now, since you're no longer able to see friends, have hangouts with your friends, and you learn to appreciate each other. What kind of discoveries, what things have you discovered about each other?
Well, I've already known Krista as quite a passionate traveler, and since we obviously can't travel right now, I'm glad we've had this time where she can revisit her hand at painting. She's done already one painting right now. I look awesome. Thank you, Krista. Thank you, darling. She's already working on a second painting as time allows for her. And I just have this I've known that she's a good painter, but I've rediscovered it. And I've seen how happy and how much enjoyment she finds in it.
As for me, I've discovered it when things started to change at my hospital. There was a moment where the patient I took care of that had COVID-19 was in isolation from his Navajo community all the way up north. And so he came all the way down to Phoenix to get treated. And the isolation part was the part that got me. It's like his family's away. His wife is being treated for the same thing up north. And so that separation for a length of time was very difficult for him. I'm pretty sure he was quite lonely. So it kind of changed perspective, not only with the changes at work, but knowing that I still have the chance to go home to my own family. It's a blessing in disguise that we can actually have this time now.
And at the same time, we're finding new places to discover in the Phoenix area. Just today, we finally visited a garden, which has a rose garden section, and very beautiful. It's been not even half a mile away, and we had the opportunity to actually visit it. Krista likes flowers, as we've mentioned.
Well, thank you so much for sharing your stories with us. I'm just wondering, how many years have you been married?
We've been married
for... like you're still newlyweds.
We've been married for a year and a half. If we include all of our dating time, we've been together almost 7 full years now. But no, wait, a little over 7 years, or about 7 years. So,
yeah. Okay. Well, I mean, that is one of the positive things about this, even though we're having this pandemic, is that people like you, couple, discovering each other, learning new things about each other, and doing things together. So that's one of the positive things. Families, we hear stories of families, reconnecting or strengthening their relationship with their children, between parents and children. So thank you so much for joining us, and we hope your story will inspire others to find blessings in their everyday moments. But before we let you go, do you have any last-minute advice to our viewers regarding their time at home, although you've already shared so much? Any last-minute reminders or advice to our viewers?
Really do not take anything for granted. Things that you may love doing today, you may not be able to get to do tomorrow. Try not to take anything for granted. Cherish those important things. Hold on to your passions. Explore them. Use this time now. Don't feel like you can push it off till tomorrow. You're going to feel good about doing what you love doing.
Stay motivated at everything you're passionate about. Go for it. Get up out of bed. Make your bed. Set the tone for the day. Play with your pets, and talk with your loved ones, and make sure they're safe and okay too.
Also, take the time to relax. Enjoy this hopefully good weather wherever you're at. enjoy nature, enjoy the air. You'll feel good. Thank you so much.
Thank you.
It's been our pleasure as well. Thank you.
Thank you, Neil and Tristate. Thank you so much. Now, a few reminders before we end today. Wash your hands often with soap and water. Cover your mouth and nose if you're sneezing or coughing. Avoid touching your eyes, nose, and mouth. Avoid contact with sick people. And if you're sick, stay home and call your healthcare provider. Continue to practice social distancing, making sure you're keeping distance between yourself and others, and avoid crowds. But if you do have to go out, wear a protective face covering when out in public. And finally, as we stand together with kindness and support for each other to build stronger communities, let's continue to thank our frontline and essential workers with a round of applause. We appreciate you, every single one of you. That is today's ABC International coverage of the Coronavirus Pandemic North America edition. Thank you for joining us. I'm Anna Cui, and we live